My name is Kristen Valle, and this video will consist on how to measure blood pressure. You will need a stethoscope and a blood pressure cuff. Also, make sure that there is minimum amount of noise in the room so you can hear through the stethoscope and the room is at a comfortable temperature. Have your client be in a seated resting position for 5 full minutes with both feet flat on the ground and their legs uncrossed. Make sure their arm and back are supported and their arm is free from any clothing. The client should not have taken any nicotine, alcohol, or caffeine for at least 30 minutes prior to having their blood pressure taken, nor exercise 60 minutes before. Make sure you select the proper size cuff because if it is too small, you may overestimate the blood pressure, and if it is too big, you may underestimate the blood pressure. Secure the cuff firmly around the upper arm and have the center of the blood pressure cuff over the subject's brachial artery, which is 1 inch above the antecubital fossa. When using the stethoscope, the prongs need to be facing outward. Be sure to have the diaphragm of the stethoscope over the brachial artery. Finally, you will inflate the cuff to 200 millimeters of mercury, but in this case, we will inflate the cuff to 180 millimeters of mercury. Release the pressure at a slow rate of 2 to 5 millimeters of mercury per second. Listen for the first systolic reading, which would be the first cord cough sound as blood starts to flow through the artery. Continue to listen and the diastolic blood pressure would be marked right before the cord cough sound disappears. Make sure to wait 1 full minute before repeating the procedure. This table shows the classifications a person may fall under. The blood pressure classification is considered normal if the systolic blood pressure is less than 120 millimeters of mercury and the diastolic blood pressure is less than 80 millimeters of mercury. If the systolic blood pressure is between 120 and 139 millimeters of mercury and the diastolic is between 80 and 89 millimeters of mercury, the classification is considered pre-hypertension. If the systolic blood pressure is between 140 and 159 millimeters of mercury and the diastolic is between 90 and 99 millimeters of mercury, the blood pressure classification falls under stage 1 of hypertension. If the systolic blood pressure is greater than 160 millimeters of mercury and the diastolic blood pressure is greater than 100 millimeters of mercury, the blood pressure classification falls under stage 2 of hypertension. This concludes the procedure on how to measure blood pressure.